I'm a clinical psychologist for 40 years and a psychoanalyst. I'm also a sex therapist for about 40 years and a couples therapist. So I really like to bring a lot of threads together and integrate them. And I love when psychoanalysis deepens sex therapy, but I also love the ways that sex therapy adds something so important to psychoanalysis. So that's my passion, working with couples and having all of that available to me, and training is my passion. And I'm super excited because I just signed a contract with a colleague, Dan Rosen, runs the Sexual Health Center in Rochester, and we're going to be editing a book together. And the title, the working title right now, is Therapeutic Approaches to Out of Control Sexual Behavior Operating Beyond the Sex Addiction Paradigm. So that's also coming down the pipe. Well, I also, one of the things I integrate into my work is I come from a harm reduction background working with substance use. And I think the harm reduction background, it really fits wonderfully with sexuality, because it doesn't come in with a set of assumptions about what should happen and what sex should look like. And that emerges in one's dialogue with your client, right? It cannot be known a priori. So I like that. And that fits just beautifully with the work that Doug and Michael did in developing their model. It's a really nice fit together. I think this topic is so important because there is so much confusion. And there are these silos, the sex addiction silo and the sex therapy silo, and they don't interact very much, though I think that's changing a little bit because I do think sex addiction therapists are getting more training than they did initially, which was zero initially in sexuality. But I think it leaves the public, people looking for help, and therapists, especially general therapists, so confused about where to send their struggling patients, how to think about it, what the treatment should look like. So I feel like trainings like the one that I'm going to be participating in are so important to help clarify what is this phenomena, how does one assess it, what do you do with what you've assessed, how do you help couples. And so I really think it's important for us to think through in a very careful way what we mean when we say sex addiction and what we mean when we say out of control sexual behavior, which is much more in line with how I think about what goes on for people. I had a call from a new referral about 2 weeks ago, and the woman, she was so distressed. She had just found out that her husband of like 30 years had been going to happy ending massages twice a week. And she was distraught. She didn't know what to do, but she really put her finger on it when she said to me, I need to know if he's a sex addict, because if he's a sex addict, he needs to get treatment for that. And he needs, that's how we're going to approach it. But if it's really about something going on in him around midlife or something in our couple, then we need to approach that and understand together what's not working in our couple. And I thought that kind of represents the issue. This behavior is not seen on a continuum. It certainly is, being out of control can cause a lot of terrible, painful issues in an individual's life. You can lose your job, you can lose your partner who you love. But I don't think it's helpful to think of it as a separate phenomena that needs very specialized addiction treatment. Though I think there are some things we learn in a harm reduction approach around substances that are helpful to people struggling with being out of control. I did a training last week, and I had this thought, and I shared it with the audience. I said, we can use there are many ways we can avoid our feelings, and we can avoid difficult, painful feelings with lots of activities. But if you were sleeping a lot to not feel a certain pain, we wouldn't say you have a sleep addiction. We would say you have a problem in that you're sleeping a lot to not feel your feelings, and let's look at those feelings. So that's why I think it's important. That's a long answer to that question. I'm going to be addressing working with couples, which is something I do a lot of in my practice. And when couples come in because there's been an infidelity, and I think we very loosely slap sex addiction label onto infidelities, and we really need to do an assessment about what actually is the problem that the couple and the individual is struggling with. But these are situations that are really challenging for the couple therapist or the individual therapist who's sitting with the couple, because feelings are so intense. People feel so raw and devastated and dysregulated. So you really need to have a framework to hold you when you're sitting with a couple that's so distraught. And you need to have a model in your head for how to approach it in a way that is, I think, systemic, that holds both people's experience in mind, that helps the couple reconnect, but also differentiate, that does a good assessment once the situation is a little calmed down about what's going on. Is this something the individual is struggling with, or is this really reflective of an issue in the couple that needs attention, or both? So in my talk, I'm going to talk about a lot of the things that can be underlying this when we see this behavior. I'm looking forward to being able to share when you have a couple come in and they're in so much pain, and they're up till 4 a.m. trying to find their way out of it, talking every night, and they're just not getting anywhere. And when you can intervene to calm down the system, and a different conversation can begin to happen, and they can begin to experience each other differently, and maybe even, refined love, it is really a satisfying experience as a therapist. There's something that feels so validating of this work. So I'm really excited about that. I also get really excited about looking at this OCSB in the context of culture, because couples who come into your office are part of the culture. I really find that interesting and important to locate the couple's work in a bigger cultural perspective, and I'm going to be talking about that a little bit as well.